South Africa has confirmed its first case of the coronavirus. A 38-year-old man from KwaZulu-Natal who recently returned from Italy has tested positive for COVID-19. The man had been in self-imposed quarantine since the 3rd of March. The National Institute for Communicable Diseases confirmed the case after being sent there to investigate by the Department of Health. Joining us in studio now, we've got Professor Nelesh Govender from the National Institute for Communicable Diseases. Prof, thanks so much for coming in and welcome to Morning Live.
Thank you.
All right, there's a lot of panic out there. We have to start there because people are genuinely worried about coronavirus. Is the panic warranted? What do we need to understand about this?
Well, I think the first thing to realize is that there's a single confirmed case of COVID-19, a single person who's traveled back from Italy, and so there's no evidence, we have no evidence that there's transmission of this virus in the community. And so I think that there is no need for panic. I think that people need to prepare themselves, educate themselves about this illness, but there's absolutely no need for panic.
Okay, one of the questions people are asking is, all we've been talking about is particular focus on the airports, OR Tambo, the systems are in place, nobody's going to be allowed in if they've got it. He did come in, he had it. He not only flew from wherever he was flying to Johannesburg, got through immigration, and then managed to get onto a flight to Durban as well. He obviously wasn't showing symptoms. Now, this is where the concern's coming in. How did he get in? What's the protocol there?
So, the Department of Health and various other departments have set up screening at all our ports of entry. And so that screening, as you know, is temperature screening, but people may not actually exhibit any symptoms or signs of illness when they pass through. This particular person was asymptomatic, and so will come through without being picked up. But I think it's really important for people to realize that there is a net, there's a safety net. We've got good surveillance, we're prepared to respond to new cases imported from other countries, and so the system clearly worked in this instance. You see that the person developed symptoms, saw his GP, the GP called the NICD, we took this call and went ahead with laboratory testing and confirmed very rapidly. I mean, our turnaround time is 24 hours from the time the specimen is received in our laboratory. So we were able to make this diagnosis really quickly, and as soon as we knew that this person met our case definition, he was immediately advised to self-isolate, which is the current recommendation.
We had got news that the Institute, and there have been a lot of suspected cases that are under your radar and that you're watching in South Africa, none confirmed. Obviously, the first confirmation yesterday. Was this one of those cases?
Yes. So I was on call personally, and I screened this case. And so absolutely, on a continuous basis, we are screening people who meet our case definition, but very rapidly, as I say, we're able to take them off that person and investigation list and advise the healthcare providers that they are in fact that they've tested negative for this test.
So the individuals now, I mean, obviously there were other passengers on this aircraft that were traveling with the gentleman that has now been confirmed to have coronavirus. Are they at risk? So,
as various members of government have said over the last 24 hours, the NICD is in contact with the airlines, the Department of Health is in contact with the airlines, because remember that this virus is spread by respiratory droplets, and also secondarily by contamination of surfaces. And so,
which is the hard thing to contain. I mean, especially on a plane.
Absolutely.
Yeah.
So, but primarily, this is a respiratory droplet spread. So it's essentially people, a meter or so, 2 meters or so around this person. So we're currently saying people who are who've sat 2 seats on either side, behind and in front and on the sides, are close contacts. Everyone else on the plane would be considered casual contacts. And of course, cabin crew who were dealing with this particular person would of course also be considered a close contact. And so the airline is in contact with passengers, and people will then be monitored according to our protocols.
Okay. So, the talk about it getting into the air cons and being pumped around the plane and all of that stuff, that's not a concern. It is an actual physical contact.
So I think it's really important to remember the routes of transmission. It's respiratory droplet spread. So essentially, if you are a sick person and you're coughing, then what you should do to protect everyone else around you is wear a mask, and you should make sure that you use good cough etiquette. So cough into your elbow, cough into a tissue and throw that tissue away. Make sure you wash your hands after you cough into your hands if you do that. But if you are a well person trying to prevent illness, then what you need to do is obviously keep away from people who are obviously coughing, keep a distance. And also, I think it's really important to practice good hand hygiene, because as I said, the secondary route is if those droplets contaminate hard surfaces, you touch them and then touch your face. You then are at risk for this infection. And this is very similar to influenza and the common cold. This is basic respiratory hygiene. So I think that's a really important message to get out there.
So I'm digging into this case because this is an example, obviously going forward, and people need to have this information. And in between, we'll obviously bring up other things. For instance, masks.
Yes.
Do they help? I went to an outlet yesterday to just go and buy normal meds, and I just inquired, do you guys still have masks as a matter of interest? And they said, no, sold out, and we're not getting any deliveries anytime soon.
So I understand that people are concerned, but I think that the important message is that masks are not necessary to prevent infections if you yourself are well and you're just concerned about getting this infection. In fact, we are concerned that in fact if you're wearing a mask and you're not used to wearing a mask, you're more likely to then touch your face to adjust the mask. And that in fact increases your risk, because you're then taking your hands to your face, which is not a good thing given the secondary route of transmission with this particular virus and the cold and flu.
So getting back to the case, so we talk about the aircraft and those that have been in touch. We've covered that. I'd like to again talk to the group of people that have been traveling with him. Apparently there was a group of 10. We know that his family are also being monitored and in quarantine. That's his wife and 2 children. What we also know is that the school that the children go to have closed for today. These are the cases I want to talk about and how fast this spreads. I mean, the kids at the school that have been in touch with the other children, these kind of things. Perhaps you can educate us on that now.
So I think it's really important to think that we're looking at a person, an index patient with an illness. And so we're concerned about his close contacts and his casual contacts, but predominantly about his close contacts. As I said, those are people who live in his household, people who work with him and may have come into contact with him recently, but I don't think that's relevant in this particular instance. And of course, people in the aircraft. So those people would be considered close contacts. And for those people, we're obviously advising very careful monitoring for the next 14 days. They, of course, would be in quarantine, as you've pointed out. And then, of course, you've got casual contacts. So casual contacts are people who perhaps have not, like I said, in the same aircraft, but not sitting right next to this person. And those people would be recommended to self-monitor, to avoid non-essential contact with others. But I think that's the important message.
Coronavirus is a flu-like symptom that you get. From the symptoms that this man came forward and said that he was struggling with, sore throat, cough, general malaise, just a general feeling that people have when you're not feeling well, you've got the flu. Let's talk to the recovery rate of this. I mean, it is almost impossible to contain the flu. We've had the flu forever and centuries, and we continue to do this, and there's always a different strain, and there is no cure for the flu. Now, we talk to coronavirus and the difference between coronavirus and the flu. Help us understand this.
So they're caused by completely different viruses. Influenza circulates, as you pointed out, every year and causes many people to become ill. A small proportion of those people develop severe illness.
And die.
And die.
What is the death rate on a flu, your normal flu?
Well, it's well below 1%, but they are, again, with influenza, particular high-risk groups. And those people, the elderly, those with illnesses, already cardiac, so heart and lung diseases, for instance, those are the people we strongly recommend should receive the annual flu vaccine.
Okay.
And so that's really important. I think that influenza circulates obviously in our winter months, and so, round about now is the time people should be thinking about getting their flu vaccine.
Yeah.
This will not protect against this new coronavirus, but it will protect against flu, which, as you point out, looks very similar.
And so now important. You've explained the flu, but now the difference from the flu and coronavirus.
So coronavirus is a brand new virus. This emerged very recently. We're only beginning to understand about this particular virus. There is no vaccine, so it can't be prevented at this point. There's no new treatment. There's no specific treatment for this particular illness. And I think that we're at the beginning of learning about this new virus.
At the beginning of learning, and and that to the detriment of the public, because people are living in fear. As we started off this interview, there's a lot of panic out there. Some people, not sure what to do. Do I travel? Do I go to KZN? Do I go to big events? I mean, I know, if I'm not mistaken, there's the cycle challenge that's happening this weekend in Cape Town. Some even questioning the Comrades Marathon that's said to be taking place in Pietermaritzburg, close to Hilton. Some saying we are flying to KZN. What do I do? What should I do? And these are the kind of questions and real questions people are asking. So let's ask, big gatherings, should they still go ahead? Now I'm talking specifically South Africa. Travel plans, should they be put on hold? International travel plans, particularly to places like Italy and China. What are you advising?
So, just to start with saying that I think it's important to realize we've been monitoring the situation really carefully from the very beginning. And there's a huge amount of work and research, and I think we understand a lot more than we did 2 months ago. The pace of learning is incredible. In terms of your question about social gatherings, I think, as I just loop back to my initial message, that we have one confirmed case. This person traveled and acquired infection elsewhere. We have no evidence at this point in time that there's circulation in the community in South Africa, in any community. So at some point in the future, things may change, and we may advise limiting social gatherings, but at this point that is not the messaging, because that is not the situation.
Yeah. So that
today there is no transmission. Correct.
As it stands today, weather changes. We are now obviously coming out of summer. We're going into the colder winter months, and we know that there's the flu strain coming up, which is difficult. I mean, and some people thinking you'll probably see things going better in the northern hemisphere and worsening in the southern hemisphere. Again, fake or myth? Or is it the truth? What do we look at that?
So we are moving into our winter months where we have other problems, influenza, other viruses will start circulating. But I think that is why we're so focused on containment of this particular virus. Every single case, we're trying to break the transmission chain so that cases can be contained. So we're focusing on this containment to delay this beyond our winter season as far as possible.
All right, this is valuable information. We have got the Minister who's going to be joining us as well at 7 o'clock, and so he's going to give us more of an update on what's going on. But in terms of the panic that's out there, I think we've heard some sobering news and some advice from Professor Nelesh Govender from the National Institute for Communicable Diseases. South Africa confirming its first case of the coronavirus. A 38-year-old man from KwaZulu-Natal who recently returned from Italy has tested positive for COVID-19. Let's take a break. News at 7 after this.